And welcome back. Well, as I said earlier, we're right in the middle of enrollment period for Medicare Advantage, looking at your drug plans, all that, and it can be quite confusing. So we have a guest on today from the Orange County Council on Aging. We have Susan Zafan. Did I pronounce that right?
That's right.
Okay.
Yes. Mm-hmm.
And you are the Education and Outreach Specialist. Welcome. Nice to have you here today.
Good morning. Nice to be here.
And as I said, this is the time of the year that can be a bit confusing for people. And together with other agencies, HICAP, Council on Aging, works together to bring some information to folks, and you're going to have some talks coming up as well, right?
We are. We're going to be hosting some open enrollment clinics here.
Mm-hmm.
The dates and times I'll share with you during this presentation.
Great.
And we'll also be doing some presentations as well.
Okay. First of all, talk about the agency. You do a lot here in Orange County, and do you go beyond the Council on Aging? Are there like Council on Aging LA and the Bay Area and that sort of thing, or is it just here?
It's primarily just here.
Okay.
It's in the Orange County area. We do have offices
okay.
in San Bernardino and in Riverside.
Okay.
But we are based here primarily in Orange County, and we've been serving the senior population here for over 40 years. With specialty education and services for both seniors and people with disabilities.
Okay, and how do you work with and or differ with HICAP?
We became part of the Council on Aging and became called HICAP in the 90s.
Okay.
We're really part of a network of national SHIP programs, state health insurance programs.
Okay.
But we work with the council, and our name was then changed to HICAP, Health Insurance Counseling Advocacy Program.
Okay. So that's really what you are, and right here you can kind of get an overview of kind of the things that you do. Certainly education and outreach, we hear a lot that you folks do in many different things, not just when it comes to insurance needs, but you will go off the Council on Aging and have talks on many different programs. And over the years, we've had several people on that talk about programs that are coming up, advocacy groups, all kinds of things, right?
Yes. The genesis of the agency started in the 70s, where a group of concerned citizens got together and put an ombudsman program together,
Mm-hmm.
where they began to be the vanguards of seniors who were in long-term care facilities. No one was really being their advocates or representing them. And that was really the genesis of the agency. Since then, in the 90s, HICAP joined and has now extended their services to cover Medicare education, which is really needed in the community.
It definitely is. So let's talk about this now. We're getting into the enrollment period, and this is the time when it can be quite confusing for people, and in other ways it can, for the people who are at the age that they can do this, it can be absolutely wonderful. First, we got the enrollment dates up here.
Perfect.
But let's talk about who can enroll in these plans, at what age, and do they need to be on Social Security? If they take Social Security early, can they do that then? So let's talk about that.
Typically, the average Medicare beneficiary, one has to be 65 years of age to be eligible, or one has to have disability for 2 years, and there are certain also diseases such as end-stage renal disease and Lou Gehrig's disease that qualify one for Medicare. One does not have to age into the program if you have those disabilities.
Okay.
The vast majority of beneficiaries are 65. And you have 7 months to sign up when you turn 65, 3 months before your birthday, the month of your birthday, and 3 months following your birthday.
Okay. Do you have to sign up? Maybe you are at the point in your life, you'd like to have your own insurance plan. You can pay for it, so do you have to sign up for it?
That's an excellent question. We get that question a lot because many seniors now are working past the age of 65.
Right.
You are entitled to Part A of Medicare, and it is premium free. And we strongly recommend at the agency, so does CMS and so does Social Security, that you sign up for Part A, which is hospitalization, when you first become eligible for Medicare. It is premium free. There's no premium associated with it, and it will work with your current insurance if you are working either as a secondary or a primary insurance.
Okay, so why not? Definitely. The other plans that are out there, and this is where it can really get confusing for people, that do they just want to go on straight Medicare and have some supplements along with that, or do they want to take a Medicare Advantage plan, which is basically somewhat like an HMO they may be used to, right?
Yes, it is. They have this sort of pathway when they first enter the Medicare system. Many people stumble into making decisions at this point, and it's very unfortunate because many of those decisions are irreversible. We really advocate people getting educated before they first sign up. They have two choices primarily. They can go into what's called Original Medicare, which is just as the name implies. Original Medicare hasn't changed much since 1965 when it was first introduced. And that is an 80-20 fee-for-service system. And in that system, they would also wish to take out a supplemental or gap insurance to cover the 20% that the government doesn't pay. And then they would take out a prescription drug plan to avoid penalties at the time that they enroll in Medicare.
Okay, and the prescription drug plan, is that the Part D plan?
Correct.
Okay. What about the Medicare Advantage plans? Now, we know here that over the years we have learned through having different guests on that right here in Orange County, they are great because there are a lot of competitions. Most of them are premium free, but literally people can be living just a few miles from here. They can be living inland a little bit, Murrieta or down in San Diego, and the plans can be totally different, which is, when you think about it, it's kind of unfortunate. You would think that California would have all these plans together, but that's where the confusion comes in.
It is confusing. The good news is that in Orange County we have 33 Medicare Advantage plans to choose from. The bad news is we have 33 Medicare plans to choose from, and how do you make a decision which one's right for you? That is one of the services that the HICAP program can help provide, is demystifying your choice.
Okay.
It's interesting that 47% of the total senior population in Orange County has chosen to go into Medicare Advantage plans. And one of the reasons for that is, like you point out, there's no premiums. In addition, they often cover things that Medicare doesn't cover, which is vision, hearing, and dental care. And so there's many advantages, and hence that's why almost 50% of seniors are in these programs.
Okay. Is there a reason when it comes to this that maybe somebody chooses not to go into those programs? Let's say they do live in this area, and many of those Advantage plans offer different things and are premium free as well. Why wouldn't you go in one of those plans?
Well, that's a very good question, and I think it's a very personal question. It's often based on your lifestyle. You are required to live within their service area. If you're spending 3 months of the year to visit your granddaughter in Hawaii and another 2 months of the year visiting your son in Miami, a Medicare Advantage plan that requires you to reside in their service area is not for you.
Okay.
You would want to pick a Original Medicare that gives you the flexibility of seeing anyone, anywhere, without a referral from a specialist.
Okay, and there again, that's what makes it differ from an HMO plan. It's I have an HMO plan. If I go somewhere for 3 months out of the year, it doesn't matter. And I'm not sure why we haven't come to that with the Medicare Advantage plans and how they can be so different throughout not only Southern California, but around the country. That's what makes it hard for people to wade through that.
It gets confusing.
It does.
Sure, yes.
Open enrollment, we've talked about this, is going on right now, and you guys are having an event coming up right here at the city, Laguna Woods City Hall. It's coming up October 29th from 9 a.m. to 4 p.m. And actually before that, you'll be in the Laguna Woods Community Center on Thursday, October 22nd. And this is a chance for people to come in and get some information from you folks, right? And just learn about what you offer and maybe kind of wade through a few things, right?
Well, first of all, there's two advantages of coming to a clinic. One is anyone associated with the Council on Aging is not selling you anything.
Right.
And then the second thing is that we're knowledgeable in Medicare. That's what we do.
Mm-hmm.
So we would love people to take advantage. There are actually 50 clinics throughout Orange County that we are going to be hosting, and 3 of them are right here in Laguna Woods. It's easy to make an appointment. We request that people make sure that they just put their drugs in a paper bag. Don't list them out on a piece of paper.
Mm-hmm.
Just come with your Medicare card, your insurance information, your drugs in a bag, a bottle of water, because you might have to wait a few minutes. And at these clinics, the wonderful advantage is that you will have a qualified, trained volunteer who will sit with you and navigate the website www.medicare.gov and enter a profile for you and then compare plans.
Okay.
They make it so that you can look at the current plan that you're on and look at 2 alternatives.
Okay, I think that's great. And again, they can answer a lot of questions for you. And just you're going to ask them, are you going to be in this area most of the time? Because that's a question. There are a lot of people here that may go somewhere for several months, and that would take them off an Advantage plan, right?
Yes, there are. You have to be careful when you sign up for things.
Mm-hmm.
If you're in a Medicare Advantage plan and you sign up for a standalone prescription drug plan, and the Medicare Advantage plan that you're currently enrolled in includes a prescription drug plan, you're at risk of being disenrolled from your Medicare Advantage plans.
Okay.
So this is always something that we would guide people through so that they don't purchase something that they don't need.
Okay.
If you're in a Medicare Advantage plan, it's not necessary to buy a Medigap or supplemental plan. It's unnecessary.
Okay.
So these are things that we can help people decide about.
All right, very good. So you can go online to the Council on Aging. It's coaoc.org and get information. And keep in mind here that both October 22nd here in the Community Center building and then October 29th over at City Hall, they will be available there for you. Do they need to call for an appointment?
We would prefer that they
Okay.
call for an appointment, and if there's a husband and wife coming, we would prefer that they make 2 appointments.
Make 2 appointments. Okay. They're the numbers on the screen, and that's where you're going to go to make these appointments. And it's going to be a great event. Take advantage of it, seriously, because even if you have something that you're happy with, why not get some more free information?
Absolutely. And it's not necessary to make changes if you're happy with your
Exactly.
plans. It's totally optional. But should you want to really explore cost savings, particularly in drug plans, this is a great opportunity to do so.
Definitely. Susan, thank you for coming
Thank
here today.
you.
Nice to meet you.
Nice to meet you
And
too.
again, we'll announce those when we get closer to those dates, but go to the Council on Aging here in Orange County, coaoc.org for more information. Thank you very much. We'll
Thank
be right
you.
back. Great. You did great.
I did.